Hello, everyone. Thank you for joining us for this HeadMed chat. Mālama Kekahi, which means take care one to another, part of our community focus series to discuss the impacts of tourism on pandemic containment in Hawaii and how communities can work together to stay safe despite the lack of government support and intervention in the pandemic crisis. My name is Dr. Shanice Hudson. I'm the chair and science director at Head Medicine Initiative. And tonight we have Melissa Bolton, Director of Community Care at Head Medicine, our first host panel. So welcome, Melissa.
Hi. Aloha.
Head Medicine Initiative is a collective of scientists, physicians, hackers, and assorted geeks dedicated to protecting Black and Brown lives throughout the pandemic, reducing health disparities for all vulnerable populations, and curbing the spread of misinformation. Head Med Chats, our signature event, is an effort to bring the expertise of healthcare professionals and others to those communities, and our goal is simple: help us, save us. And today we are honored to welcome back Mel Raposo, Special Investigator for the County of Kauai Prosecutor's Office and Prosecuting Attorney's Office. He's the co-host of Mel and Charlie Live Show, a community-oriented podcast that's recently been focused on the pandemic issues facing local communities and how state policies are failing to protect them. He's a former Kauai Police Department officer and was first elected to City County Council in 2002 and served into 2008. And then he was reelected 2 years later and served until term limits made him ineligible to continue, acting as council chair for his final 2 years in office in 2018. We are so excited to have you back, Mel. How are you doing tonight?
Thanks for having me. I'm feeling great, awesome. I want to welcome our viewers for the Mel and Charlie show. They're jumping on right now. Thank you, guys. We'll see you guys at 7. We'll see you at 7.
Okay, and we are also joined by our very own Dr. Kapono Chong Hansen, who serves as the medical director at Ho'olahui, Hawaii, Kauai Community Health Center, which is both the Native Hawaiian Healthcare Systems Office for Kauai and the only federally qualified community health center primary care safety net on the island. He is a recipient of the Native Hawaiian Health Scholarship and attended the University of Southern California Keck School of Medicine prior to family medicine residency at the University of Hawaii. He is also a board member of Aha Hui o Nakauka Association of Native Hawaiian Physicians, serving as the chair of the advocacy committee. He plays and continues to an active role in advocating for safer travel policies throughout the COVID-19 pandemic, as well as outreach to the unsheltered and the hardest hit community, the Pacific Islanders on the island of Kauai. He provided mask, hygiene supplies, testing, and eventually vaccinations. He collaborated with a group of kumu hula masters and teachers to implement the Lahui Kanaka Kapu in efforts to quell the surge in cases Hawaii experienced around August of 2020. The Hawaii Public Health Institute honored him as a public health hero in April of 2021 for his work during the pandemic. Mahalo, Dr. Kapono, and welcome back to Hood Medicine.
Thank you. I probably should have made that shorter. Thanks for having me.
I love it.
No, give him all his flowers. We got a real life hero on the program. And tonight, also for the first time, we have Dr. Jonathan Dworkin, a clinical infectious disease specialist on the Big Island in Hawaii, and author of what will be available this December. It's a new book called Plague Doctors: How Hawaii Battled the Pandemic. It's about the experiences pandemic in Hawaii, and in particular, the toxic politics that made it harder for us to fight the disease. He served as an advisor to the mayors of Honolulu and Hawaii counties during COVID-19 crisis. He's written widely about the state's faltering pandemic response. In Plague Doctors, his front row seat and hands-on involvement provides invaluable insight into how the state handled or mishandled the first 18 months of the pandemic. And we are excited to hear you tell us all about that tonight. So welcome, Dr. Dworkin.
Welcome, welcome.
Thank you, guys. It's an honor to be here.
Mel, hello, my brother from another mother. I'm so excited to have you back.
You're twin.
Yeah, how has it been going? I feel like we need to give each of you, first of all, like a solid 15 minutes of rant time, just like at the top of the hour. But how do you think it's been going in terms of like since we last spoke? Oh, Mel, we can't hear you.
Okay, can you hear me now?
Yeah, yeah, there you go.
Sorry about that. Yeah, I muted myself out. I'd love to defer to the experts because I think people are sick and tired of hearing from me. But not much has changed since the last time we spoke. We had the huge surge a couple of months ago. A lot of people died here in Hawaii in a very short period of time, and we're kind of at a lull right now. The numbers, have gone back down to the 150, 160 a day, but the deaths are still happening, and that's what's concerning myself. And at the same time, our state leadership has decided that it's time to open up, that that life must go on. And our lieutenant governor this morning on the news said there's very little virus in Hawaii, so go enjoy yourself. And I'm concerned that the message that is being heard from our residents and visitors as well is that it's really, really, really safe right now, and I think that's a scary thought.
And Dr. Dworkin, based on your book title, I'd like to know what you think about the response and how it's going so far.
Yeah, I'll second everything Mel just said. We just experienced a big wave here on the Big Island where I was, and at our peak, I work in a fairly rural area here. On our peak day, half the hospital was COVID, and the entire ICU, the rural ICU, was COVID. That's tapered off quite a bit in the last few weeks, but we still have a slow simmer. And most days that I'm there, I'm seeing COVID patients, almost entirely unvaccinated COVID patients, and some travel related. So the problems are not solved, and it's kind of mind blowing to me that 18 months into this, we still don't have post arrival testing as a routine thing that we're doing for people coming in. Even though we now have widely available rapid antigen testing, this should be something that we can figure out. But the preferred strategy seems to be to pretend that there's no problem and just get as many tourists in here as possible and not pay too much attention to what the downstream effects of that are. So, since the beginning, I've been advocating not putting the economy and health at odds with each other. And we now really have some practical tools that would allow us to do that. And we can have locals traveling to the mainland and coming back, and we can have people from the mainland coming here safely. The tools exist to do it, but we're still not doing it. So that's been one of my big focuses lately on the policy side. But on the clinical side, I'm just keeping my head down and each time there's a wave, it's a little bit different. And I find myself doing different things to try to support the patients through it. And I learn a little bit each time. So this one's been different than the last one for sure.
In what way?
Well, it's been different in terms of the dynamic of who's coming in. So during previous waves in Hawaii, we didn't have widely available vaccines, and now we do. So there's this real divide between vaccinated and unvaccinated. And I don't know what the tone of this has been on the mainland, but here, it's created a lot of tension. So when the hospital filled up with unvaccinated patients, and we had people marching in the streets against vaccine mandates. But at the same time, we had our vaccinated patients who needed care and couldn't access care because the hospital was being overwhelmed. I was mad as a physician. It was a hard few weeks for me to be rounding in that time. It was difficult. So there's that side of it, and then there's also just the clinical stuff has changed. You know, we have monoclonal antibodies now that we're using that were not as widely available. So one of the things we set up in North Hawaii was a monoclonal antibody clinic. So we're trying to get people into the clinic before they get really sick and end up in the hospital. But then it's a challenge of helping people access the care. Some of the drugs we're using in the hospital are different than drugs we've used during previous waves. So every time this happens, I think we get better at managing the disease clinically each time we see a new wave. But it's always tragic, and there's always bad outcomes. It's always better not to get it in the first place. And that's what's made this last one so demoralizing for me, because 90% of the destruction was totally unnecessary.
And what about you, Dr. Capono? How is the landscape changing in your estimation in terms of the sentiment, in terms of like, are we like at the last holdouts in terms of people who are resistant to the vaccination, or is it still sort of more widespread, just vaccine hesitancy?
Well, I just looked back. Where were we when we last saw you guys? It was like in May,
Yeah.
So I mean, the COVID world for us, to me, is completely different than it was in May because of the Delta surge. And the Delta surge exposed things that I think we didn't expect to happen. I mean, our vaccination rates were pretty good leading up to the Delta surge. I'd have to look back at the numbers, but I want to say it was at least something like 60 to 70% of the eligible population was vaccinated around that time. But the Delta surge exposed how probably under-vaccinated. We still don't have great numbers, but really the Native Hawaiian population got hit hard by the Delta surge, and most likely it was because we're under-vaccinated compared to other people in Hawaii, which is similar to what's happening in Aotearoa, New Zealand now with Maori, and what they're doing over there. We lots of times compare ourselves to them. So I think it exposed that vulnerability, and I'll admit, I underestimated it. I thought we were doing better than we were, but it showed how important the data gap is. A lot of that has to do with racial disaggregation for Native Hawaiians and Pacific Islanders. And then, it hit home on Kauai. I mean, I am happy to not be in the hospital and not have to, round on patients in the ICU cursing at me, telling me, I'm I'm part of the conspiracy, when we're trying to save their lives, and I feel for guys like Dr. Dworkin who are out there doing that. But I was trying to connect the dots with the Regeneron monoclonal antibody treatment, and reaching vulnerable populations, particularly our Ni'ihau Hawaiian population. It finally got into that community, which smallpox didn't even get into Ni'ihau, back in the day. So, that made a different situation for me. I sort of feel like it's not really like I take care of that entire community, but I feel a special connection to caring for that community because of the organization I work for and the history of how it was formed. But, we were doing that every day, trying to figure out how to get people transportation. Sometimes we went to people's houses to give them the Regeneron treatment. And so I think we're able to mitigate the risk through that. But since then, now I think it was a wake-up call that Native Hawaiians are really vulnerable, that our pretty good vaccination rates are not good enough to prevent a surge that challenges the oxygen supply and the hospital capacity of the entire island. So, now we have holidays coming up. We got the booster recommendations came out, and then just this week now we're looking at Pfizer 5 to 11, age 5 to 11 being approved, right? So, really, I'm just relieved to be out of that surge and what we were facing throughout the month of September. But I feel like we're not out of the woods yet, and we have a lot of work to do to get people's boosters done, get the pediatric age group vaccinated, and then we have holidays and travel, coming up. And I agree with Mel and John. I'm just, I'm not surprised about it, but it's like moths to the light. Politicians in Hawaii and in a lot of places, just as soon as there's a sign that it's letting up, it just is like, okay, well, we can get back to completely normal. even though we're looking at like the UK right now, and they're seeing a resurgence because they tried to rush back to, I guess, normal, which usually means gatherings and lack of masking for indoors. So I see the same thing where it just seems like we can't stop it. I mean, I heard the lieutenant governor say, is it even possible to have another, and it's kind of like, of course it's possible. I mean, we still have, unfortunately, a lot of unvaccinated people, not only in the United States mainland, but around the world. And that environment, it sets up the possibility of another variant like the Delta variant or worse that just gives us a setback. So, I'm basically just trying to insulate our community as much as possible and really do more outreach to Native Hawaiians for vaccine hesitancy. And Melissa probably saw this, but I mean, I think the Native Hawaiian healthcare system has really stepped it up lately as far as messaging. There was a really nice video, pretty humorous, called Our Kuleana, which is sort of like our responsibility. And it talked about actually my ancestor who did vaccinations in a smallpox epidemic in 1853, and the mandate that the Hawaiian Kingdom made the next year. And I in hindsight, I think that's like one of those things we should have been messaging that in February. I mean, in the beginning of the vaccine roll, but better late than never.
Okay, so that being said, I have a question. Since JW isn't here, I have to ask you. Do you think our state leaders from the beginning of this pandemic should have immediately consulted with Native Hawaiian and Pacific Islander physicians to protect them due to ongoing health disparities in these communities, to better equip them? Going to Native Hawaiian physicians, Pacific Islander physicians to get consultation how to culturally approach these communities instead of, just going off just basic Western science. Because I mean, we have a different way to approach, things. How do you feel about that as a Hawaiian physician?
Well, in hindsight, of course. But at the time that the vaccination started, Native Hawaiians had fared fairly well from the data that we had. And it looked like other Pacific Islanders, a lot from, what we call Micronesians, but Marshallese, FSM, Federated States of Micronesia, were getting hit harder. I think the state identified that population needed particular outreach, and I was part of that too. And I think, like Ralph, who Dr. Dworkin has worked with, really saw that need. So I think they identified that. And I guess I don't completely blame the state for not focusing more on Native Hawaiians. They did involve the Native Hawaiian healthcare system. So, there were Hawaiian physicians involved. But it points out the problem with a lack of data. So this problem was sort of hiding underneath the radar until Delta exposed it. And even when you look at the data on the state website, it says, well, this is after March 23rd. And it's kind of like, well, on Kauai, we did a ton of vaccinations of essential workers before March 23rd. So I'm not sure what to make of it. And then when you look at the racial data, it also doesn't include anything outside of VAMS. So how reliable was it? But I do think we should have seen it coming, and we should have been thinking about messaging earlier on. I think a lot of people in the state have seen a PSA that was made, and I'm in it, with Ahahui o Nakauka. Dr. Blaisdell, who's a psychiatrist, donated some of her own money to make that happen. But, that was in the spring and into the summer. So, I think they should have seen it coming. And I think people did realize that, like Governor Ige, politicians are going to have a hard time reaching the Native Hawaiian population, especially with, TMT, the telescope on Mauna Kea, and feelings about how that has been handled. So, really, Melissa, I think in hindsight, of course, it could have been done better. I think it is getting better, but it was just late. The big thing is data disaggregation. And I think I've been working with the Department of Health too, trying to come up with, well, how could we do it better in the future? I think the other organizations we left out was the civic clubs. Hawaiian civic clubs
Mm-hmm.
are really widespread, and they have the connections with the community that other organizations don't. So I think that's, you know, a lesson that we could have done better. And I think we have to really look at it like we do have a Native Hawaiian healthcare system, but as far as the funding goes, as far as being a comprehensive service, it's not like Indian Health Services, you know, so it's nothing close to that comprehensive. So, you know, that's a weakness. And then coming back to that data disaggregation, and I think people are going to realize in the future that we really need to be splitting out Native Hawaiians and Pacific Islanders from Asians, and then subgroups of Pacific Islanders and Native Hawaiians to be, if we're going to manage another pandemic or another surge.
Okay, so one more question. Do you believe the vaccine hesitancy is a result of generational trauma due to the overthrow of the Hawaiian Kingdom? Also, how do you believe our current state leaders moving forward can rebuild the trust, especially in medicine and healthcare?
Well, it's certainly a factor. I think there's just a, you know, ever since the overthrow, there's sort of been a feeling amongst Native Hawaiians that this government doesn't represent me. They, you know, don't prioritize our priorities like Mauna Kea. Some people, I think, feel that the state would be happy for us all to die, because then all the Hawaiian homelands would be, you know, basically free for them to, you know, use how they like. And the Mauna Kea Road is an example of that, you know. And that's, I'm putting that, you know, very, very, you know, grossly, but I mean, I think there's just that feeling underneath it. And so when it's the governor or state politicians or the Department of Health saying, this is what you guys should do, it's going to be like, you know, first of all, no, I don't want to listen to you anyway. You know, we have the history also of like Kalaupapa, the way leprosy was handled, which basically was a public health excuse to disempower Hawaiians and put them into exile on an island, you know. So I think some people remember those things. And unfortunately, I think not enough people remember like the story that we were talking about, where the Hawaiian Kingdom, when given the opportunity, was willing to spend the money to protect people and mandate a vaccine. And I think people, a lot of Native Hawaiians maybe never learned the history or just have forgotten how devastating
I was about to,
epidemics were. And, you know, for some of us that learned the history, as soon as this happened, it was, you know, it was like mobilized, you know. And I think now that I'm more about, you know, my great grandfather doing it, it feels like, okay, this is why, you know, I mean, it feels natural. It makes a lot of sense to me. I think it's going to be on Olelo. I did a recording to try to do another PSA related to that. But in that Arkuliana video, I thought they did a really good job with a humorous take on that, with the, you know, TikTok videos and stuff like that.
Yeah, because even I told my mom about that history, and she's Hawaiian, like, you know, and she's like, really? And I'm just like, yeah. And I mean, I was happy to share that with her, but in a way, I was so saddened that a lot of our elder kupuna don't even know our history. And that's sad, you know? So I'm happy that, well, I'm not happy that this pandemic happened, but I think I'm happy that our history is being spoken about, and hopefully our community will really believe us, our history, than, you know, somebody on the internet and telling you to do crazy things. So
well, I agree. And I tried to make the point that, you know, most Native, I can't really prove this, but I would guess that most, if not all, Hawaiians alive today are descended from people who got vaccines to survive. I mean, at some point, I think it's very, very likely, it'd be very unlikely that any of us alive today had an ancestor who did any vaccine for anything.
Exactly.
Yeah. Mel, what do you think, how do you think that is like playing out in terms of like local policies and, you know, all of the little practical things that the state could do to help protect the population, but they refuse to do because they'd rather prioritize like commerce and tourism?
Well, I mean, it's no secret that tourism is the lifeblood of Hawaii. I mean, that's just unfortunately that's the way we've become. And from day one, our state was more interested in revitalizing the tourist industry, the visitor industry, and they put that in front of public health and safety. I mean, I could sit here and give example after example, but I think that's common knowledge now in Hawaii. But we started off all right. We got off the rails pretty good, and then we just got weak. And safe travels, this what I call this unsafe travel program, which they still boast as the best. In fact, I heard the lieutenant governor today say that the federal government is using his safe travels program as a model for the international travels. I'm thinking, come on, man.
Oh,
Uh,
wow.
yeah, he said that this morning. I was wow. So he said, we should be proud. Well, number one, if I had to say, the number one thing is I would never have stopped the pre-travel testing, never, whether vaccinated or not. To me, that was key. It was somewhat successful, although we know that the 72-hour test is, we do allow virus to come through, but as opposed to not having a test, the pre-travel test was number one. I think that should have never been taken away. Post-travel testing, as Dr. Dworkin mentioned, today we have antigen tests. We have rapid testing that's very inexpensive. To me, every traveler coming into the state, whether it's a visitor or a resident, should get five of those things or four, and every day of their visit, they got a test. And if they get a positive, then they get a follow-up PCR test. But for me, I would tie it into their hotel stay. You stay in our hotels here, and you're coming from somewhere else, and obviously, if you're at home because you're a returning resident, same applies. Every day you test. Well, for the visitors, we get to control them with a room key. So they get a room key with single entry. They take a test. If it's negative, they get to use the key until 4 days. After 4 days, they test negative, then they get a key for the remainder of their stay. That is one way I think we can really prevent additional virus and variants from coming in. So, but that's not even they haven't discussed that. That's not even on the table post arrival, and I think that's a huge mistake. We're going to find out in a few weeks or months once we open up, as we just did. The other thing is restricting high risk areas. Oahu right now is wide open, 100% capacity at gyms and bars and restaurants and uh,
Mm-mm.
the luau's, the visitor industry, the tourist luau's were never restricted. We got luau's here on Kauai, 350, 400 people, 2 or 3 times a night. Uh, they're not wearing a mask when they're eating and drinking. That was never restricted. And our state leadership has gone out of the way to try to convince our residents that uh, the virus that we see here is not from visitors. It's all from all from our residents, which is crazy. Church is another huge cluster point. So I think those are the key things that I would not have stopped. Uh, and tourism can coexist with this virus, but we got to do it safely.
Right.
No doubt in my mind. And we constantly, our leadership constantly makes concessions for the visitor industry and not in the best interest of the public health and safety. So I'm worried about what's to come. I really am. But unfortunately, this we're going to have to go through it. And one of our senators, Senator Donna Mercado Kim, said a long time ago on our show. She said, "Hope is not a strategy," and that stuck with me because that is the strategy of our state leadership right now. Is they hope that it works out, but from the evidence that we're seeing from other countries and other states, we're heading down the wrong road, and the minimization of the dangers of this virus and the variants, I think, is what disappoints me the most. The messages coming out of the state from our governor, lieutenant governor, and the mayor of our city and county of Honolulu, Mayor Blangiardi, came out and said, "We are now it's now an endemic. It's endemic. It's not a pandemic anymore." That is not correct. That is a lie. But it's to validate himself or justify to his own self that what he's doing is safe because we're no longer in a pandemic, we're in an endemic. I believe a dangerous statement to make, because a lot of people will believe that and they will drop their guard. So I'm concerned. I really am.
Yeah, that's what we've been focused on since the beginning, is just immediately realizing that our government was going to blunder the response and not prioritize people's well-being and safety over money. And we've, made sure a lot of our focus is on helping people understand how they can protect themselves and not just rely on like the policies and whatever. I mean, just because Applebee's open doesn't mean you have to go. You know what I mean? But like, Dr. Dworkin, how can we move towards that? I mean, do people really understand? It doesn't sound like, I mean, obviously, even here on the mainland, people don't understand what's at stake, but can you talk to us a little bit about what you're seeing clinically, like what COVID really is like, in case people are still unclear?
I think the essence of this is narratives, and when Mel was just describing this narrative of minimization, this narrative of commerce, right? And this narrative of, okay, we're over this, it's an endemic, and we got to get Applebee's open. And what I found myself very drawn to was Kapono's family narrative. I want to know about your ancestor, man. That is a really interesting story.
Oh, me too. We'll definitely get to that. Yes.
How do you know more about that guy?
Please share, Dr. Kapono.
I mean, this stuff is what really fascinates me, and when I was a resident, when I was a young doctor walking through Queen's Punch Bowl, doing my residency training, I walked past that portrait of Queen Emma every day. And, for the first month or two, I just thought it was a cool portrait. And then I started reading a little bit about it. And I realized that whole hospital system was built in response to that 1853 smallpox epidemic that Kapono mentioned, that his ancestor helped fight. And this stuff is resonant, like we've been through this before. These are stories, these are family histories, right? And once I began to appreciate the history of the Queen's Hospital, I began to pass that portrait and I'd look up at her and I'd say, okay, that's my boss. That's who I'm working for, right? And I'm not working for an insurance company. I'm not working for the hospital administrator. He may be a nice guy. He may think I'm working for him. I'm working for her, right? And we're all working for her if we're in this hospital. And what was she trying to do? She was trying to beat back epidemic disease that was threatening her people, right? And this is where we are today. So there's a really proud history here that we can tap into if we have some imagination. And I don't know, those are the kinds of narratives that interest me, that I want to try to convey to people. And when I talk about the history of vaccination with some of my patients who are vaccine hesitant, a lot of them are very mistrustful of Western medicine. And it's not just minority populations that are mistrustful. I have lots of white patients who are really mistrustful of Western medicine too. And one of the things I say is, why do you assume that this vaccination thing is all Western medicine? Do you know the history of vaccination? Do you know about variolation? Do you know where variolation comes from? Americans and British were like the last people in the world to figure this out practically, right? Yeah. It came from China. It went down the Silk Road. It was in the court in Istanbul. It came from the Islamic world. The British were horrified by it when they first encountered it. They thought it was barbaric, right? Cotton Mather.
I think it was a slave here that first started using cow pustules. Yeah.
Onesimus was his name. That was the name that they gave him. He had probably a different name when he was in Ghana. But he was in Boston during a smallpox epidemic in 21, I want to say. And Cotton Mather, who has got to be the whitest guy in history. I mean, this guy was like a Puritan minister who was famous. He's now most famous for witch hunting, like literal witch hunting, not metaphorical witch hunting. And the slave Onesimus, explains to him, and I try to imagine this scene. I can't imagine this scene. Oh yeah, we don't have that problem in Ghana. What do you mean we don't have that problem in Ghana? Well, we do this thing where we get variolated, and we don't get smallpox. And I'm just imagining all these New England guys standing around going, okay, thanks, Onesimus. And then they just steal the idea. They steal the idea from the guy, right? They write their letter to the Royal Society. Nobody gives Onesimus any credit, right? You know, this is deep in our history, this stuff, fighting disease in this way. And I don't think we should allow this to be co-opted by for-profit corporations or you know, colonial governments. I mean, this is people's medicine that we're trying to do. So that's kind of how I push back on this stuff a little bit, and one patient at a time, you know.
Dr. Capone, can you tell us about your ancestor?
Sure.
Break it down.
You know, I wanted to say something to John. You know, when I saw you on your Hawaii Music and Film Festival, I realized I think what we have in common is we both have a humanities background. You know, before medicine, I studied anthropology. You know, so I think that's undervalued. You know, but I mean, that's one of the things that I think helps some doctors to sort of bridge this gap in communication, you know, and I realize now, I'm like, that's a lot of what we have in common. We've tried to collaborate working on writing things, and I think we both like each other's writing, but sometimes we're like, I don't know if we can write this in public, man. But anyway, I appreciate about the narrative, you know, and I remember in medical school, we were talking about narrative medicine and how important it is. And so I agree with you on that. So yeah, this is my great grandfather. His name is Samuel Manaya Kalani Kamakau. He's well known as a historian. Of course, I would say he's the greatest Hawaiian historian, but he's definitely up there in the top 5. The state Hawaiian collection is named after him. There's a charter school named after him. So you might might remember the story of Maui, but so Kamakau means the hook, and Manaya Kalani is the name of Maui's hook. So we have a connection to that history, you know, through our family. I guess maybe I can show this. So I have his picture right here. I think is this him? You want to pull it up? Yeah, that's him. The most well-known portrait of him. And then I was going to show, so this is my oldest portraits of my family. So I'm not sure, I think my shadow is blocking it out, but this guy is his grandson, and that's my great grandfather. And I just wanted to share this quickly. I'm not sure if you can see this, but this is a collection of coins from the Hawaiian Kingdom. And someone on this chain. And I liked it, and I wanted to share it with you guys because I think people don't realize what the Hawaiian Kingdom was. I mean, it was not like, oh, you know, the chiefs decided we were a kingdom and had some subjects. You know, we were recognized by, I think it was called the League of Nations at that time, but, you know, sort of like the UN at that time as a nation. You know, we formed treaties with a lot of countries, European and Asian. And we were not an ignorant people. We were one of the most literate people in the world, even though our language was oral. As soon as we learned about writing, we said that we got to learn that. You know, our people need to learn that. And we did. And as soon as we saw what the world had to offer as far as technology, you know, health, military, we sent our brightest people all over the world. You know, and I have another ancestor who went to Oxford. We all know he went to Oxford, but we don't really know why, but he did. You know, I mean, he ended up over there. And so, you know, my point with that is I think we're in this era now because of misinformation, social media, internet, that has been termed a celebration of ignorance in America. And I kind of want to scream at my Native Hawaiian people that we are not an ignorant people by history. You know, like we're never that way. You know, our ali'i, as soon as they saw opportunities, they didn't say, oh, you know, we know better, or we're just gonna pray and have God help us. You know, it was learn these things. Even if, you know, the vaccines, even if you view these vaccines as being produced by your enemy, which some people I think would say that, you know, the United States is my enemy because they took away my kingdom sovereignty. They overthrew our government. well, you learn from them, you know, and if there's something good that your enemy has, you take it. I
Yep.
mean, you know, like, I guess it's kind of like I look back at Kamehameha. I don't think he would have said, oh, I don't trust cannons because I don't trust England. You know, like, it's, I see what cannons can do. I'm getting me some cannons, you know. So I mean, I
Right.
just like try to emphasize that history. I wish we
Right.
learned it
Learn
better
your enemy.
as a people. And I'll admit, I knew a lot about my ancestor, but I didn't know this specific thing about 1853. So yes, 1853, he was working as a judge and a legislator, no medical background, you know, at least from the Western side. Mostly had been working as a historian. And he basically was seeing, he estimated 7 out of 8 people who got smallpox in his community died. 50% of the people were getting it. And he was aware of the government basically screwing up. You know, I mean, the doctors that were supposed to be in charge of this couldn't figure out, you know, how to pay for it, even though a lot of people were saying we should pay for this for all of our citizens and we should make the smallpox vaccine available. So from what I read, and this is the book where I've gotten the most information from. It's called Sharks Upon the Land by Seth Archer. But it just sounds like he got fed up with it, and he was like, I know how to get this vaccine. I'm getting the vaccine. I'm going door to door, you know, and vaccinating people because I can't watch this. You know, I can't put all my life's work into preserving our history and then watch more of our people die with every wave of disease. And, you know, the estimates are 7,000 or so people died in that epidemic of 1853. And then the vaccines were mandated in 1854. You can read the mandate too. And it wasn't like, we'll wait till the data comes in. It was like, by the time your baby is 6 months, it will also be vaccinated. So, I mean, it just set it up and it was paid for too. But you see a lot of parallels, you know, I mean, there's also at that time, all these churches that were saying, well, we got that, you know, we have the religious answer for why this is happening. And, you know, if you stay with us, you're going to be okay. And then, you know, the viruses don't care what church you're in. And so, I mean, eventually those things, you know, kind of fell through. But I think it hits upon another aspect is that a lot of Native Hawaiians are very Christian. And I think a lot of that came out of these pandemics where, you would look at it and, well, the Native Hawaiians are dying, but a lot of the Europeans are not, you know, and the Europeans are the Christians, and the Native Hawaiians are not. Of course, it wasn't directly related to Christianity, but I think that fueled it. And, you know, even in this era now, we see the same thing where there are churches that, to me, they're giving misinformation. They're saying it's the mark of the beast to get the vaccine, and our people pay the price, you know, for that as well. So the long story short is I agree with John about the narrative. You know, our history now, this example, I think, is something that we need to be teaching all of our children more often. And certainly it makes me even more proud of my ancestor, you know, to have this aspect. And it helps me to talk to patients who are really hesitant because, you know, I had a patient who was really angry, really wanted me to write a medical exemption for work, you know, to not have to get a vaccine. And I shared with him my perspective. And finally I said, look, I understand where you're coming from. This is my family history, though. This is my ancestors' history. This is where I'm coming from, you know, and I hope you can respect that. And, you know, finally he said yes. And then I told him, you know, the experience for me is not that, you know, I want to beat you up. The experience for me is that if I hear later you catch COVID and you are in the hospital or you are a long hauler, I'm going to always wonder whether I tried hard enough, you know, or whether I communicated the best way that I could. And eventually he got it, you know, so it just helps to have those kind of stories to be able to communicate, no matter who you are as a doctor. And I think the Hawaii connection is really valuable in this case.
I love that. Dr. Dworkin, I know you have to leave a little bit early. I wanted to give you a chance to tell us about your book, and also maybe just tell us a little bit about how you've been doing and how you're coping. I know that, you know, this has been really hard on medical professionals and frontline workers. So maybe you could share a little bit about that and tell us about your book before you go.
Sure. Well, you know, the narrative has kept me going, you know, this whole time, and when the pandemic was first coming, I looked at that portrait and I thought, are we going to repeat history, or are we going to have a different ending now? How's this going to be? And as a physician who was not born in Hawaii, but who has lived here for 15 years now, who married a person who grew up here, I've got to step up. I've got to do my part to fulfill the Queen's mission and protect the population of this island. You're not going to hear me shilling for the hotel industry, or trying to carefully triangulate hotel revenue versus mortality, like some of our sad local politicians do. I know who I represent and what I'm about, and that's kind of kept me focused and kept me going. So we had hard waves. I think for me, maybe the hardest was at the very beginning, before we had testing available, because I was afraid we were going to get socked before we were ready and before we knew what was going to happen, and that we would have a situation that was similar to what happened in New York. And I remember the testing came online, just a week or two before the first real wave hit Honolulu. It was just in the nick of time, and it was a very tense few weeks. And each wave has taxed me in a different way. That, like I said, the Delta wave in some ways was the hardest because of the frustration of seeing the self-inflicted injury, and it was disproportionately hitting, Native Hawaiian and Pacific Islander populations, because those were the more under-vaccinated populations, and that was very frustrating. I felt like I was failing, to do my duty in this way. But I'm fine. I don't worry about myself at all. I just want the state to do well. And my struggle with that is all in the book. It's kind of a personal tale. It's being a doctor when it hits the fan, and when there's a lot of things we don't know, and how do you navigate uncertainty, and how do you navigate chaos? And then as we began to self-organize, and I began to meet people like Mel and people like Kapono, people like Melissa, we became more self-organized. And then I got sucked up in some of the policy discussions under the previous Honolulu mayor, Kirk Caldwell, under the previous Big Island mayor, Harry Kim, as I was shifting my practice from Oahu to Big Island. And so those stories are in there too. But I just wanted to attempt to write a history of this that would hopefully be relatively entertaining for people, but that would do some justice to the themes that we've been talking about today. So that's the book. It's not a very big book. It's about 250 pages, I think. But that's what's in it. And my hope is that somebody in the future who picks it up and has a similar challenge can read it and think, okay, they've been through this before, and they figured some things out, and take heart in it.
Okay, so it's Uncle Mel that has to go early. We're still gonna keep these two positions. They ain't going nowhere.
Oh, okay, good.
But I was like, oh no, it's Uncle Mel. He has his show to do. So, Uncle Mel, the question of the night: if you could lead the state of Hawaii, what would you
totally should. No.
Moving forward, what would you do better moving forward? I mean, we understand the testing and post-arrival, but what would you do better or improve?
I think the overarching thing, the one thing that I would do differently, besides what I mentioned earlier, would be just being transparent with the people, being honest with the people. I'm starting to think that this is like a screenplay for a movie, and all of these people are writing this screenplay as they want to see it to end. And in a movie, you control how the movie ends. You're the writer, you're the screenwriter. You control every part of that movie. But in a movie, it's entertainment. This is real life, and you don't have the luxury of controlling everything in this environment. But I think we went sideways when we started to manipulate the numbers, when we started to change the way we reported the numbers. if you notice this, if you're in Hawaii, you notice on Mondays and Tuesdays our numbers are low because it's the delayed count from Saturdays and Sundays. Today was 30. They make their announcements uh, to the world on the days that are on Mondays or Tuesdays because that's when the numbers are low. I think we went wrong when we started to keep the people out of the loop. It is what it is, and I think the people deserve to know the good and the bad. But from the beginning, it was structured in a way that to convince the people that it wasn't that bad, that we had to open right away. Everything was geared towards opening up. Everything was geared towards the convenience of the visitor. Never mind if we lost what, almost 200 people in a month with the last spike. That's unacceptable. And as the docs, every doctor you talk to, and nurses and people, even therapists, Melissa, people like you that see all these people dying when they shouldn't have died. It was unnecessary. It was preventable. So that's the frustration. And if we were just honest with the people, letting the people know what is really happening, and that, hey, if you put the visit industry above the health and safety, then let the people know. I can respect someone even if they're stupid. I can still respect them if they're being honest. But when they try to make this virus seem like it's nothing, and it's happening now, and the people are believing that, and the people are letting their guard down because of what they're hearing from our state leadership. In football, if you got a fourth and long, and you call in the punter. You don't let the quarterback, you don't let the lineman punt. You call in a punter, specially trained punter, to punt the ball away. Well, we were fourth and long for quite a while, and when in a crisis, in a pandemic, your punter is your medical experts. That's who you call in, and you give the ball to your medical experts, and you say, "Hey, we got your back. Go save some lives. We want to save as many lives as possible." The dialogue now is, bring in the visit industry people. We want to help you guys as much as we can, and 10 deaths a day, 12 deaths a day is acceptable. That's an acceptable loss for us because we believe the visit industry and the revenue they generate is much more important. That's the message I get because we've been covering this for so long. But for the average person coming in and watching the news, they're not seeing that. They're what they're seeing is that, wow, we're at the end of this. It's safe again. You saw the party in Waikiki this Halloween night. You see
Yeah.
the thousands of people like it was a mass orgy with no masks.
Yeah.
Do you think we're not going to see a little consequence from that? Absolutely. So, you asking me what I would do? Number one, I would be transparent. I'd be open and honest with the people. Everything would be that the testing would be obviously. We're testing so few people now, so our numbers are lower. I would
Hmm.
never have eased up on the testing. I would have promoted the testing. We should be going out with testing and vaccination vans. Every single nook and cranny of our Hawaiian community should have access to testing and vaccines. Uh, and then travel,
Hmm.
tightening up our shores with testing, vaccinated or not. I'll just say this. My daughter, unvaccinated, right? She was unvaccinated. She caught COVID from a vaccinated person who who had very minor symptoms.
Yeah.
He came out okay. My daughter got very ill. Well, she's vaccinated now. My point is, all of those people coming across in that airplane, riding that plane for 6, 10 hours, vaccinated, many of them can still infect others. And we need to catch them before they come onto our shores. And the only way you do that is pre and post travel testing. That's what I would implement right away.
And what do you think, like, the community can do? What can citizens do better to protect themselves? I'm guessing starting with like not going to the luau every night, but what can we do to be more responsible for our own family safety?
Wear your mask. Keep your disinfect yourself. Stay away from gatherings. In Hawaii, our culture is one that encourages the hugging and the kissing and the like many cultures. It's not just the Hawaiian culture, but it's hard when you go to a funeral or you go to a wedding. It's very hard to practice social distancing. So for us as individuals, we got to be smarter. In Hawaii, we say akamai. We got to be smarter, and we got to not put ourselves in positions that will put us at risk. If everyone did that, we would have no cases. We would have no cases. But the
I
temptation,
know, right?
the culture, the cult is so strong. It's very, very hard.
Yeah.
But yeah, it's individual responsibility. We've been preaching that for almost 2 years now. But yet, again, if the message coming from our leaders is that
Yeah.
the worst is over, then maybe I don't have to wear a mask because that's my auntie or that's my uncle, that's my nephew. It's Halloween. Everybody's vaccinated, and that little bit of contact creates an exposure, creates an infection, and then with this Delta, it just goes crazy. So yeah, individual responsibility is regardless of what the leadership do.
Yeah.
I don't need a mask mandate from the governor for me to know I got to wear a mask.
Period. Two masks.
I don't need a law to tell me I got to wash my hands after I pee or after I touch something.
You
I don't need
should.
a law.
Yeah.
That's right. That's right.
Exactly.
Because of individual responsibility. So.
Yeah. I wish everybody would take that to heart. But I mean, to the point about, individual responsibility, I just feel like, that's kind of been our attack this whole time. It's just making people understand that, like, the government doesn't probably care about you. Like, they might, like I said, the Applebee's is open because they want Applebee's to be able to make money, but that doesn't mean that it's safe. And it doesn't mean it's safe for you and safe for your family. And it's like
Well, one more thing
people,
one more thing real quick. The other thing that I am totally upset about is the fact that they don't disclose clusters. They don't disclose where the cases are happening. We very early on, I said, when we have a shark attack on a beach, it's not a HIPAA violation to tell people there was a shark attack at the beach. At this beach, don't go in the water because you're going to get eaten. That happens all the time. With COVID, they tell you there's a cluster in a restaurant or a faith-based worship area or a bar, and they're very selective on what they share. Well, if you want to stop the virus, and it happened at a McDonald's or an Applebee's or whatever, you need to let the people know. And that's what we don't do well here in Hawaii. So people are running around not knowing that where they were last night had an outbreak or had a positive case. And that to me is foolish, totally foolish.
It is unfortunate. I'm hoping that throughout, as we approach the holidays, we can find ways to help people talk about that better with their families, because I feel like people feel hesitant about asking people about their vaccination status. But the thing is, it's like, we're not new to this. Like when you have a new sexual partner, I hope you ask them if they've got like googly bugs or HIV. You know what I mean? Like, we ask people, like, if you, like, before the pandemic, somebody's like sneezing, runny nose, you're like, hey, stay over there. Like, we understand how viruses spread, and it just seems like people are really reticent to talk about it, but you need to talk about it because the virus doesn't care about our hang-ups, honestly.
Yeah.
It's like Capone's point.
Well, I think one of the great things that
Mel.
Bye, Mel!
No, I want to hear what you say about Mel said.
Well, for what Mel's show did is, to me, I think it provided an opportunity for people at COVID to be public about it, even if other things weren't being public. And I think it helped people to not have shame, and I think that's something that Hawaii can do better than the mainland is be honest about it, don't be ashamed about it, care for your community and share that kind of information. So that, that created a big dialogue, I think, when I think he knows the guest that I'm talking about but he had a few guests, but, that really started people talking about it. Yeah. And that was a great change. But I understand, I work with public health too. And so I do understand their concern is that if you out things publicly, then sometimes people will not communicate with you anymore. And I think that that's their concern, and maybe in other states where there's more of that celebration of ignorance or whatever you want to call it, yeah, you're going to have organizations that are just like, we're going to hide it then. You know, we're not going to talk to public health authorities. Yeah. But I think Hawaii's culture is different, and we can be different for the future.
Awesome. Thank you so much, Mel. We'll see you later.
Thank you.
Love you guys. Stay safe.
Love you
Again,
too.
thanks to our viewers who jumped on. I'll see you guys in a little bit. Aloha.
Bye, Uncle Mel.
Aloha. Just to continue in that vein a little bit, maybe we should talk a little bit about how to, or first of all, what are the recommendations for this winter for family gatherings, holidays? Where are you guys at, and how you feel we should be making those recommendations? How about you, Dr. Dworkin?
Yeah, I mean, the fundamental transmission dynamics haven't changed. You know, it's a virus that really likes indoor spaces, and it likes unmasked people, and it likes poor ventilation. It's a party animal. It likes parties. You know, it does not like long walks in the woods. You know, so this is how I sort of tease my patients. You know, imagine if it had like a social media profile or like a dating app profile. You know, it really wants to get close. It wants to get close. It wants to snuggle.
I love that. I'm feeling that. That's going to be an infographic tomorrow.
Most definitely.
There was a really cool commercial, I think it was in Canada, I saw, where they sort of played with this a little bit, where, you know, the teenagers are having a house party while their parents are out of town. And one of the teenagers has a big COVID sign over his face. Nobody else knows that he's got COVID. And they're just like sharing beers, and he's slow dancing with the girl, and the whole thing. He leans in for a kiss, you know. So I mean, we all know how this thing spreads. It's not a mystery anymore. And I think what we're encountering is just fatigue. People are sick of it, you know. And I was on the East Coast about a month and a half ago, and I realized how good Hawaii actually is when I was over there, because I was in like one of the bluest parts of the Northeast, and it was, you know, it was much less mask wearing than I see anywhere in Hawaii. And it made me realize we've actually done a lot well in Hawaii. Most people are doing the mask wearing. Most people are you know, thinking about their neighbors. Our vaccination rate is pretty high. I think because we had this big ocean border, we didn't have as many natural infections last year. We despite how imperfect our border control was, we did have that 14-day quarantine for 7 or 8 months in 2020. And I think we probably only had 10 or 15% of the state infected going into that vaccination program. And then we vaccinated 60%. And then we got hit with Delta. But places like New York, they probably had 30% of the population infected. And then they vaccinated 60%. So what I noticed when I was on the mainland was it was simmering along, but it wasn't. There was not this big meltdown in New York, in Jersey, like we had here in August, September. And I don't know when we're going to get to that point, you know. But you know, my plan is just to continue to do smart things. I got an 8-year-old who hasn't been vaccinated yet. I want to see him get vaccinated, and when we're all vaccinated, and you know, and maybe boosted for those of us who have the occupational risk factors, I will incrementally increase my social activity, but I'm going to be careful about it. I'm going to continue to mask indoors. I totally support the state continue to do that. I think that's a big thing we have to focus on, Kapono, is making sure that the indoor mask thing through the winter continues, and that doesn't just get dropped, because I can already sense that that's the direction it may head in. And then we'll have to see what happens. You know, they just opened bars until 2 a.m., even though they haven't vaccinated kids yet, right? So I was talking to Mel about that last night. Is just sort of a classic example of bad priorities, right?
Yeah.
We're just about to do age 5 to 11. We haven't done it yet, and the bars are all open on
right.
Honolulu.
Or at least take vaccines to the bars. Or I don't get it. Like, have
That's
a
genius.
vaccine. I believe Dr. Kapono them did it on their island. They had like vaccine pop-ups.
You went to the bar?
It was at.
There were clusters associated with a couple, and that was related to the guest that Mel guys had on, you know. So I mean, it's just an example of, it wasn't a great situation, but in those two scenarios, instead of being like, oh, I want to hide it, you know, those establishments were like, can I do something? I mean, you know, and we had several. One of them ended up attracting a lot more people than the other, and the bar owner gave like a $10 gift card to everybody who got vaccinated. But I think we went there maybe like 4 times, maybe
That's
5.
awesome, though.
Shots for shots.
Yeah,
Right,
I mean, we had heard that was working on the mainland, you know, but I don't know.
Works.
Yeah. I mean, I think that probably was more effective than this, you know, enter a sweepstakes for whatever, 1 million Hawaiian miles or whatever the state was, you know, doing with that. It seems like that really backfired, at least in the Native Hawaiian community, from a perception standpoint, because it's all like, okay, we don't trust you, and now you're trying to bribe us. Stupid, you know, so.
Yeah. So, yeah, about those 5 to 11-year-olds, Dr. Dworkin, your son will be able to get his vaccine now starting tomorrow, thanks to the CDC approval that came out today. How are you going to talk to your patients about getting their kids vaccinated, or what do you think is the different challenge there, especially for people who are hesitant for themselves?
Yeah, I mean, there's the perception that the risk in kids is low. So oftentimes the first thing you have to do is sort of, you know, try to the actual risk in kids, because it's true it's lower in kids than in adults. But if you compare, for example, the number of children who have died of COVID in the last year compared to, say, influenza in a typical influenza season, we've had more kids die of COVID than we typically see in an influenza season, and we vaccinate kids for influenza. So it's only low in comparison to the really horrific, you know, nationwide adult fatality rate. So I try to put it in perspective while being honest that their risk is lower than in adults. And then I talk through the data. So the FDA actually has a document up, and I try to link to this stuff on my Facebook page, because I want people to be able to look under the hood when they want to and see what the doctors are looking at. So the FDA document talks through the 3,000 kids that got the shots, and you can see exactly what side effects they had. It's all right there. Now, 3,000 people might say that's not enough, and you can argue over how many kids is enough kids. Addended to that analysis, they also did a little separate analysis on myocarditis risk, since myocarditis is a particular concern based on the experience with adolescents. And they made some very probably high assumptions about how much myocarditis there will be with kids. And then they work through the risk benefit. And you can see that the risk benefit favors vaccination. So I think, you know, for me, it's convincing. My older son got vaccinated. My younger son's going to get vaccinated. You know, I'm vaccinated. I don't need to be convinced of this stuff. But I do think it's totally legitimate for people to ask questions about safety. And I try to just talk it through them and show them the data, and discourage them from going online and reading paranoid stuff, you know, so it's there. And, you know, my fear is that, is it really going to convince anybody? You know, and that's the issue. You know, an analysis of myocarditis based on a model is not going to convince somebody who has been reading propaganda online and thinks that lots of kids are dying of myocarditis. So to some extent, I think we've got to roll it out, and people who want to do it are going to do it. And then we're going to have more data. And when we have more data, then we can be more confident, and we can start getting to some of those other people who are waiting. And some people are going to wait, or some people might do a first shot and then not show up for the 3-week shot. And then we're going to have that headache. You know, do we go after them and try to get them to do it at 4 weeks, 5 weeks? So these are the things that are going to come up. But I anticipate, what is it coming out? It's about 8% of our population is age 5 to 11. So if half those kids end up getting the shot, that's another 4 or 5% of our population that's vaccinated. It'll definitely do something to make the situation safer here. And eventually, as with the older groups, we're going to have to try to get the rest of them.
Yeah. And it's basically all the school age children, and, you know, so that's, I feel like as a parent, I feel like I'll feel safer when like the smaller children in the schools also have the same protection as the older kids have had for a while now. But Dr. Kapono, so can you talk to us a little bit about how this dose is like 1/3 of the normal dose? And, you know, the CDC has noted that this was like, you know, obviously one of the largest clinical trials in history. Like they really went the extra mile to add extra kids and to expand sort of the bases